Well, as any parent knows, our children are our greatest gifts. And one of the most important things you can provide them is a healthy foundation as they enter and navigate this world.
That's why Licking Memorial Health Systems is dedicated to our youngest patients from the moment they're born, throughout the school years, and obviously on into adulthood. We want to be their resource for life.
Today we are going to highlight some of the great services benefiting our children and our families. It is a very special edition of Daytime Columbus with the Licking Memorial Health Systems. Thank you so much for joining us today. I'm Robin Haynes, and I am joined by the CEO and President of Licking Memorial Health Systems, Rob Montagnes.
Well, I'm so happy to be here, Robin. We're going to start talking about our maternity services.
And the thing about this, there's perinatal nurse navigator, new Certiscan technology, finding unique ways to really help moms and babies. And then we tackle what can sometimes be a controversial topic, which is vaccines. We'll talk about the importance, do some myth busting when it comes to protecting our kids, and even discuss pediatric allergies.
Then we're going to take a look at our Active Fit program designed to combat childhood obesity, give them some incentive to get up and move around, and then finish with our 5 facts, which we always like to do, things you should know. This is LMHS on Daytime Columbus.
All right, putting our children on the road to good health starts long before they're born. It is why Licking Memorial Health Systems is so committed to keeping its maternity care and perinatal services on the cutting edge.
We never want to say we're satisfied with just meeting expectations. We strive to exceed them, and we do that by embracing new technologies, pushing out new services beyond the norm. A vital member of that effort is with us today. We're happy to have Dr. Lauren Baker with us.
Yeah, Dr. Baker, thanks so much for being here on Daytime.
Thank you for having me.
Okay, so you are an OBGYN. I imagine that patients arrive with a ton of questions. I know I do for mine every day, or every year at least. What are the most common questions, though, that you get from expectant mothers?
So by far the most common question that I'm getting is, what can I do to have a healthy pregnancy? So we're addressing that very early, ideally having a preconception counseling visit where patients come in. We can review any pre-existing medical conditions, review any medications that they're taking, make sure that they're safe for the pregnancy, and then providing some education for healthy lifestyle.
And so how do you then address if they have a concern? Are then you going this step further and say, okay, you're on this medicine, let's stop this when you find out you're pregnant?
Absolutely. Reviewing them, making sure that it's the optimal type of treatment, making sure that it's safe, and then continuing that education throughout the pregnancy. We provide our patients a booklet the first visit that has commonly asked questions, so they can have that reference right at their fingertips, as well as talk to the on-call doctor at any time needed.
All right, good stuff.
Something that's fairly new and perhaps unique to Licking Memorial is the perinatal nurse navigator. So maybe talk about how that helps not only the patients, but you and the others that are providing care.
Sure. So this is a new position. Our perinatal nurse navigator is a registered nurse with women's health background and training. So her job in our health system is to help identify any patients who might be at risk with certain health barriers. So some of those may include transportation issues, possibly some food insecurities, maybe a patient with housing concerns, even difficulty understanding a medical treatment or the treatment prescribed, as well as substance abuse.
And is this something unique? I mean, being at Licking Memorial, I'd never heard of this prior to this.
Yeah, I think as a community hospital, these are some of the initiatives we're able to implement. So I don't know that we're unique, but I think as a community hospital, we have an advantage that we can really focus on what the community needs, and hopefully that really meshes well with what the providers need.
Absolutely. All right, so something that continues to be a challenge, I think, for the entire state of Ohio we talk about is our high rate of infant mortality.
Sure.
So how does LMH compare? Are you doing any initiatives to try and change that?
Absolutely. So U.S., the infant mortality rate is about 5 per 9 per thousand, and that was in 2017. Ohio was slightly higher, unfortunately, about 7.4. But we are proud. We are doing a lot of things at Licking Memorial to help decrease that. In 2017, we had 7 infant deaths in Licking County out of 1,900 births, which comes out about 3.9 per thousand. So different things that we're doing to help with that are the perinatal nurse navigator service that we provide. In addition, we have a one-on-one smoking cessation program. So we're having counselors meet with patients that first visit, following them throughout the pregnancy, helping with quitting smoking. We also have breastfeeding classes that we're offering, as well as a fruit and vegetable program. So if a patient is not able to access healthy foods, we can actually prescribe them healthy fruits and vegetables where they can pick up free of charge from the hospital.
It's so cool to see that, because it is about finding the reasons these are happening in the first place and addressing those. So great to see that you guys are on top of that.
Yeah, a lot of the work is done not at the actual delivery, but before and after they're discharged home. So we talk about technology with all of our different areas. CertaScan is a new technology we're using. Maybe highlight that or any other technologies you'd like to mention.
Sure. So the CertaScan is a new technology that we've implemented, one of the first in Ohio to do so. We're actually scanning the newborn's foot shortly after birth, and this serves as a way that we could identify the baby in the event of emergency, if the hospital needs to, parents, even law enforcement. So hopefully not something that we have to use often, but if it is required, something that could be very beneficial. We know that about 95% of footprints that we take, for our keepsake books and baby books really aren't good at identifying a child if necessary. So this is a very secure way that we can make sure that we're keeping our infants safe. It's not a bracelet or a little cord on the clamp on the cord that can be removed. So very safe.
Yeah, and I was just thinking that the footprint that you get and put in your baby book, sometimes you can't even tell if they've got all 5 toes on that. I mean, it's something, right, that as mothers we certainly love to put in a book, but it kind of ends there. So this is a way to keep that identity. And you can't always tell the identity of a baby. From 3 months to 6 months, they look completely different. We were discussing. So cool to see all this technology happening.
Want to make sure it's available for folks in our community.
All right, Dr. Baker, thank you for being here, for sharing us, and for taking such great care of all our moms.
Absolutely. Thank you for having me.
Oh, while treating ailments is a big part of your child's health care, so too is prevention. There's no bigger effort than the childhood vaccination regimen. Up next, straightforward answers on why you need to vaccinate.
And later, a program that's close to my heart starts by getting children active, bringing their family, their loved ones along for the ride, everybody exercising.
Well, I don't think anyone in this world can say that they love getting shots. So whether it's for an allergy or a vaccination, it's not the most favorable feeling.
But it is necessary. Something we understand that we can make better decisions for our children, the community. So Robin and I had a chance. We sat down with a couple of our health professional physicians, Dr. Tiffany Owens. She's certified in pediatrics as well as allergy and immunology, and pediatrician Dr. Rick Baltusberger.
Well, Dr. Owens, let's start with the youngest patients then. Talk to us about some of the most common youth allergies you see.
The most common things I see are when the trees start to bud, itchy eyes, watery nose, sneezing, and then there's also the cat and dog allergies. Those are a common problem with so many of us having pets.
And so what can you do to treat those? I feel like we hear about a lot of maybe over the counter, but there's a lot of people that can't use that as well.
That's true. So one of the most important things is if we can figure out what the triggers are, we figure out that by skin testing. That can help us with prevention. And it's always better if we can use treatments before the symptoms happen than after they start. So other than over-the-counter treatments, there are some prescription nasal sprays, tablets, and allergen immunotherapy. Allergy shots is a good option for many kids.
You sort of touched on it there. With allergies, are there long-term or even short-term effects to the immune system?
There are. So the allergy process is actually an overreaction of the immune system. So we want to calm that down a little bit. And by not treating allergies, kids can have trouble with sleep, behavior problems, other respiratory problems. So it's good to catch it.
All right, Dr. Rick, vaccines benefit the immune system in preventing certain diseases. How do they do that?
Well, this is a common misconception people have. People have this conception that we're injecting the body with something that then protects that kid against the disease. And really, it's an activation of that kid's own immune system. And this is where I sometimes get distressed when I hear people complain that they want their kid to learn how to fight off themselves. And I tell them that's exactly what we are doing. We're having your child learn how to fight against measles by itself. We give it a little portion, an inactivated portion in some cases. Some cases they're weakened viruses, but we inject that in their system and then their immune system acts against it. So that when they see the real thing, they can attack it and get rid of it and not suffer the long-term consequences of the disease itself.
Dr. Rick, you've been around the health systems a long time, and you know how passionate we are about making sure vaccinations are available, provided, whether it's to pediatric patients or adults, flu from all the pediatric vaccinations. But talk about some of the stigma that's out there and maybe how you react or deal with parents who have some misconceptions and even some anxiety about having their children be vaccinated.
A lot of it stems from them not wanting to do something to their child that then harms their child. We give them information on what the vaccines can do if they get the vaccines in terms of negative reactions they may have to the vaccine. But often they've come into my office and they already have heard on the internet or they Googled it and decided that there's this other side effect that's out there that they don't want to have happen to their child. Sometimes it's autism, sometimes it's even high fevers causing brain damage. And so then we have to break down those walls and say, okay, those are not real side effects from these vaccines.
I think you should speak to that specifically because autism is one that's cited quite a bit. And as I understand as a layperson, those studies have been not only, they've been found not to be true, but actually were fraudulent in their makeup. Is that a fair assessment of those?
Yeah, there was some data that was manipulated in the original studies with the MMR vaccine to make it look like it had more effect than it really did in terms of causing autism. So what we do, studies have shown that the vaccines do not cause autism.
Is most of, I guess, the biggest hurdle in getting parents to understand this education? Is that where you guys come from when you're trying to say, hey, whether it's an allergy shot or a vaccine, you've got to know the purpose, right, and what it's doing to your child.
Absolutely. And so I, for one, like it when parents come with questions. Maybe they've read a study, maybe they have a question from their doctor, and we sit down and talk about it and try to break down the pieces and see if there's something that we can do to help them feel more comfortable with getting their kids vaccinated.
All right, Licking Memorial Health Systems is dedicated to providing compassionate care for our community's children, and we even have a pediatrician, or they do, on site for the hospital 24 hours a day, 7 days a week.
But if folks ever have questions regarding vaccines or potential health risks, certainly reach out to their local physician or pediatrician that they normally see, but we're always there if they need us.
Absolutely. Great, Rob. All right, up next, we are getting the kids of Licking County up and moving with a program designed just for them. We will learn how ActiveFit is changing the way they look at exercise.
And later, a reunion like no other, celebration of life for families who are not able to have that typical homecoming with their newborn babies. A concerning statistic that might surprise some folks, more than 30% of our nation's children are either overweight or obese. So a few years ago, we decided to launch a new program aimed at changing that statistic.
And the ActiveFit Youth Wellness Program is for kids ages 6 to 12, and it's really those most at risk of starting and keeping unhealthy habits. So we sat down with a Licking County teacher learning more about just how big of an impact this is having. Rob, I want to start with how Licking Memorial Health Systems really got involved in this program. Where did it all start?
Sure. Really, throughout the entire country, most communities are dealing with childhood obesity as being a significant health issue. And we recognized that it wasn't something that we could just deal with on our own, but we had to really embrace with other audiences, schools, youth sports, just communities at large, and trying to get the kids to be more active, obviously, eat healthier, get proper amounts of sleep. And so we started the ActiveFit program, and the school systems really did embrace it, Suzanne in particular, but other school systems as well. And they were able to incorporate a lot of the principles and the thoughts that we had in terms of keeping our youth healthy and active, developing great habits for the future, and they're able to do that through the school curriculum. So we're so pleased with our partnership with so many of these schools.
All right, Suzanne, you have been a phys ed teacher. You have been in the classroom, as you mentioned, for many, many years. So when you decided, I'm going to, adopt this ActiveFit program, bring this to the students here in this district, what was kind of the process for you? How did you show this to them and get them to jump on board?
I had a lot of good relationships with the administration, so they were allowing me to to use the announcements as a kind of a springboard in the morning. The kids would hear it. I had trivia. We have different things and different posters. Licking Memorial had some really great PR pieces for us that we could put things up in the gym and around the building. And they have little prizes and incentives and great ways to kind of like spark interest with kids. But the programs speak for themselves. So we have, there's the chef active, the
Junior Chef event we just had this past weekend.
Is fantastic. And really, and we have a triathlon in downtown Pataskala, and just really building excitement. And kids really love to be active and to be involved, and just giving them the opportunity and building the joy in it. So it was a lot of fun.
And I'll add, Robin, if I might, you know, I coach a lot of youth sports. I know Suzanne's kids play in a lot of youth sports, and really this program focuses on, you know, kids being active on their own time, not requiring a coach, officials, parents that have to oversee all the minutia of being active. And we wanted to sort of bring that spirit back to just going out and having fun and being active, and not necessarily having to be on some formal team.
And you mentioned, Rob, as we were chatting about this, right, it's about getting kids active in ways that are fun, that are part of their normal life, right? So if it is gardening with grandma and grandpa, or if it is going on a bike ride with mom and dad, there are so many ways that they can do it. It doesn't just have to be, right, school gym time, but that's a great way to kind of kick it off.
Right.
And so were you seeing students kind of say, well, I'm going to do this weekend?
And they're excited, right? And they come back and they want to share. And so I was coaching T-ball at the time, and my kids were involved in swimming, and my husband coaches the high school rugby team. And as we have grown and my kids have gotten older, I still have students now who are in high school that remember, you know, when we kicked this program off. And it's fun for them to continue to have those relationships and to see, you know, it's fun to be able to see them still active.
And Rob, what Licking Memorial does with this, obviously, you know, you have fun at the end of each kind of school year, right? You do prizes and things like that. But what is this meant to do for these kids?
Well, I think Suzanne hit it really right on the head. We want them to develop habits that they'll carry throughout their entire life when they become teenagers, adults, and obviously even into our active senior program, which we have for those maybe at the other end of the spectrum. But developing lifelong healthy habits, healthy lifestyles, that's what we're hoping for, so that we can address some of the you know, community health issues that are going on throughout this country when it comes to things like obesity, health and wellness, inactivity. We want to try and incorporate that when they're young. All
right, Suzanne, thank you for what you're doing. Rob, of course, for sharing about this program.
Thank you.
All right, now this is available to those in Licking County. Rob, I know you guys have the website, and this is for seniors too, right?
We have two programs. It was so well received. We started with the ages 6 to 12, and now we've developed active senior, ages 60 and older. So go to our website, the entire calendar, list of events, opportunities to make goals and participate, and loads of fun. And even though you might not fit into either of those age categories, families are welcome at these events, and everybody has a good time.
Absolutely. Looks like fun. All right. Up next, it's Rob's chance to brag a little bit. We will go down a list of great things that Licking Memorial Health Systems is doing both in its hospital and in the community. All right, it is time now for our 5 Fast Facts segment, which I love because as much as I'm always learning something new and interesting about Licking Memorial, there is always something more, which, Rob, you are embedded in it, so you know just how much LMHS does for the community. So we're going to expand. First of all, we just talked about this Active Fit program that you guys have going on, and I love that it goes beyond the schools. So talk about that.
Yeah, we have 7 events throughout the year, and I'll make sure I get all my items here. 2 movie nights, we have the active junior chef event, we have bowling, we have a field day, so a lot of different events. And once again, the opportunity for not only the kids, but the family to come out, enjoy the events, and hopefully we get some ancillary benefit with the families participating as well.
And that's kind of leading us to the fact that we do have to practice what we preach. I want to point that out. Parents need to get healthy, you know, even grandparents. So a lot of what they do is just involving the entire family in activity.
The active junior chef event, we encourage the kids to go home and cook the meal for the entire family. So the entire family would eat healthy that night, and everybody enjoys that.
And mom gets out of cooking for them.
Mom or dad doesn't have to cook.
All right, another program that allows the community to support new parents is your Cradle Roll program. What are some of the highlights of that?
Well, I think it's a fun and a good opportunity maybe for folks that want to give back in a obviously commemorative way where they can make a contribution. the baby is recognized in one of our recognized at the hospital and logged in the cradle roll program. And then you see a nice little chair here. We also have a step stool that, depending on the contribution, is made available to the families. They take that home, and it's a memory for the entire family as that child gets older.
So can someone make a donation on behalf of another mother?
Yes, yes,
Okay.
absolutely. So that's a great opportunity if you don't want to send something through the mail, or you know, some kind of a gift that you have to
Sure.
send through FedEx. It's a nice way to do it, and it's available right there for them, even while they're still at the hospital potentially.
And I've seen that they are gorgeous pieces. So amazing. All right, Licking Memorial hosts this special care nursery event for former patients, which is a reunion. What's that like?
Yeah, and we touched on this. You know, these are families, mothers, fathers that had to stay at the hospital, weren't able to go home right away because the baby needed some special attention, some special care, maybe a week, 2 weeks. And they really build a bond with the providers, obviously the physicians, but the nurses, the other support staff. So this is a reunion where they're able to reconnect with those folks, and I think our providers appreciate the ability to see these kids as they get older. We have children that are 5, 6 years old now that our nurses and doctors remember when they were newborns.
And I think that's interesting to note that your medical staff bonds with these parents, bonds with these babies. And sometimes we may forget that on their end, you know, they're putting forth this extra care and they get to know and love these patients just, you know, like everybody else.
No question. I mean, I think a community hospital probably fosters that a little bit more because you do get to see these folks on a more regular basis. But when you spend 2-3 weeks with individuals to really continue to follow their progress, I think is meaningful.
You have inpatient pediatricians we mentioned on hand. They're able to treat young patients in the emergency departments first and foremost. So why is that important that you have that on hand?
I think for a community hospital to have pediatric physicians not just on call but available in-house 24/7, 365 is unusual. They're there first and foremost to serve the inpatient needs of any pediatric patients or mothers or babies. But if we have time, or they have time available, they're also able to go down and help our emergency department physicians and staff and see pediatric patients down the emergency department. So it really allows them to meet the needs of inpatient folks, but also help get folks through the emergency department more quickly and efficiently.
All right, Rob, you have a childbirth education program called First Impressions. What is this about?
Well, First Impressions is really an opportunity for individuals to learn about all of the services available at Licking Memorial Hospital. Teaches them breathing techniques, gives them a tour of our labor and delivery area, advice and education about caring for their newborn, classes and relaxation. So as they're embarking upon, maybe it's their first time having a child, it really provides them all the information and education that they need.
All right, Rob, incredible, because you have really shown a light on a lot of programs, a lot of services at Licking Memorial, and the difference that your hospital makes on this community. We often, you know, point out that you are a community hospital, but that does not mean that you do not have, you know, these incredible, you know, technology and innovations going on right there in Licking County.
Yeah, we appreciate the fact that we are really indebted to our community, our services to them. But we also recognize that we can be at the leading edge of technology and clinical care, and I think our employees, medical staff do a tremendous job.